section on vital signs that I want to add to your patient assessment. This will be your first skills lab that you'll do, and just like it says, very vital to what you do in the field. So we're going to cover pulse, respiration, blood pressure, cap refill, not blood pressure again, skin color, temperature and condition, pupils, level of responsiveness, and then I added this, it's not in your chapter, pulse oximeter, because you will see that in the field, you'll see that on the ambulance. Assessing a pulse, if your patient's awake, you don't want to go in there and check their carotid or their femoral or anything like that. The easiest thing to do is at the radial artery at the wrist on the thumb side, and you can check your own as we're going through this and feel your pulse. You find that if you press down too hard, it makes it go away. You press down too soft, you don't feel it. So kind of find somewhere in between that works best for you. If your patient's not awake, just like you did in CPR practice, you check the carotid artery at the neck. Check one side at a time only, not both. If you check both sides at the same time, you can slow their heart rate down. So 3 things you're going to check for when you find that pulse. You're going to check for, number 1, that it's there, and you count the rate. You'll count the number of beats for 30 seconds, so you need to watch with a second hand. You can watch that time. And you multiply that number by 2, and that gives you an approximate pulse rate for that minute. You want to feel for regularity, and it's either A, it's regular, or B, it's not. So regular or irregular all the way through. You want to feel for strength. Normal is strong, you can feel it. Abnormal then would be weak, like a thread's touching your fingers, thready, or bounding, it just jumps out of the skin. So those would be abnormal, strong is normal. Normal pulse rates for an adult, 60 to 100 beats per minute. You don't have to know the exact numbers for the child and the infant, just know the smaller they are, the faster their heart beats. Respiratory rate, look at the chest. Some people are belly breathers, especially children. Sometimes you'll see their shoulders go up and down as they take a breath. If you just stay staring at the chest, they may feel a little bit uncomfortable. So we'll show you some tricks of the trade in the skills practice that you can check the pulse for 30 seconds and still holding the pulse. They think you're counting their pulse rate for a full minute. The second 30 seconds you're looking at their chest and they don't realize it. Again, 30-second count, multiply by 2. Make sure you remember to multiply by 2. If you report that a patient has a heart rate of 32 and a respiratory rate of 8, you're going to cause some people to get really anxious. You just maybe forgot to do the multiplication. Just like pulse, look for regularity. Air should move in and out. Think about how you're breathing while you're watching this. Look for it being like a normal depth. Not too shallow, not too deep, not labored, just a normal depth. And then listen for noises. Listen to your own self breathing right now. You don't hear anything. So noisy breathing. Sometimes they'll have an upper airway obstruction that causes inspiratory as they're breathing in, stridor like this. Watch me play full court basketball. That's inspiratory stridor. Sometimes they have expiratory wheezing. And you're mainly hearing that with a stethoscope, not the upper airway like I'm making right now. Sometimes you hear snoring respiration. And it's not the person sleeping next to you in bed, it's your patient. Well, you need to open the airway. If they have snoring respirations, they have a partial airway obstruction caused by the tongue, and by positioning the airway, we can stop that snoring. Sometimes you hear gurgling respirations. That means they have fluid, maybe blood, maybe vomitus in their airway, and they need to be suctioned. So listen for noises. Normal adult respiratory rate is 12 to 20 breaths per minute. You need to remember that the smaller somebody is, the faster they breathe. Cap refill. It's a very accurate test of perfusion, what we call oxygenation of the tissues in children. So kids less than the age of 6, you'll blanch their nail bed for about 5 seconds, hold it down, and then when you let go, count how many seconds it takes to return to normal. Sometimes it's pretty brisk. Normal should be less than 2 seconds. Anything greater than 2 seconds would be abnormal. It may be delayed in somebody who's really cold. At adults, it's not real accurate, but we can still check it. And if it's delayed, then it could be a sign of shock. Blood pressure is probably one of the hardest skills that you'll learn, but once you master it, you will be a master. So it measures The top number measures the pressure exerted on the artery walls when the heart is contracting and is called systole or systolic blood pressure. The bottom number measures the pressure on the artery walls when the heart is resting, so it's a diastolic pressure. Not usually done in small children, but definitely in older children and adults. And the normal range varies from 90 over 60 to 140 over 90. Anything over 140, anything over 90 is hypertension, and then anything less than 90 over 60 is hypotension. So if they had a 142 over 88, that 142 makes it hypertension. If they had a 90 over 58, the 58 makes it hypotension. Blood pressure is too low. The larger somebody is, the higher the blood pressure, and we allot a little bit for age, but not much. Hypertension is still hypertension. Skin color. So normal is normal for them. Look at their family, look at the normal skin color, or ask the family, is this a normal skin color for them? Abnormal are your patriotic colors, red, white, and blue. If they're red, it could be caused by heat exposure or sun. It could be caused by high blood pressure, and it could be caused by carbon monoxide poisoning. If they're pale, very white, it means that they lack blood flow to that area. If they're blue, then they lack blood flow that's rich in oxygen, so they lack oxygen to that area. They're cyanotic. C-Y-A-N, like blue. If they're yellow, like this lady is in the picture, her skin's yellow, but you see it better in her eyes, it's a sign of liver failure. She is jaundice. Normal skin temperature is 98.6 body temperature, and they will actually feel warm and dry. So you pull the back of your glove off just a little bit so you can rest the back of your hand against a part of their body, usually the abdomen, to tell, are they hot, are they warm, are they cool. Abnormal would be hot, feverish. Abnormal would be cool, and oftentimes they're clammy. They actually feel wet. So a normal condition is warm and dry, but not flaking. Flaking is abnormal, too dry. Pupils. Pupils should be equal. So you look at that little black hole in the middle of the iris. The iris is the colored part of the eye. And they should be equal, not like the picture here. Unequal pupils may be a sign of a brain injury. Anytime we shine a light into the pupils, you'll notice that they get smaller, and that they get smaller together. They constrict. We have sympathetic eye movement as well as sympathetic reaction to light. So if you shine a light in somebody's eyes and they don't get smaller, then we call that an unreactive pupil. They may remain dilated, which could be a sign of a drug use or an injury or shock. Or they could be very constricted, even though it's very dark, and that too can be a sign of drug use. The neat thing about your pen lights is they have little dots on them that show millimeters, so if you're not really good at guessing size of pupils, you kind of compare that to there. Eyes also move together. So if somebody has an eye injury, we want to cover both eyes, because if we only cover the injured eye, the other eye is moving, making the injured eye beneath that pad move also. We check level of responsiveness, and we use what we call an AVPU scale, meaning that when you walk into the room, they get your attention and they're alert or awake. We give them a letter A. Or they don't look at you, they appear to be sleepy, but when I shout their name, they open their eyes enough to look at you, responsive to verbal stimuli. They don't answer when you shout their name, but when you cause painful stimuli, they moan or groan or flitch or pull away or something like that. They're responsive to painful stimuli, we give them a letter P. Or if you do all those things and they still remain unresponsive, then we say they're unresponsive. So alert or awake is normal. Everything else is what we call altered mental status. Their brain's not fully functioning. Could be a lack of oxygen, could be a lack of blood flow, could be an injury to the brain, but for whatever reason they have altered mental status. Here's the one that I wanted to add. It's not in your book. A device called a pulse oximeter. It's typically placed on the finger, but it could be the toe or the ear, that measures saturated oxygen levels in arterial blood. It works through an infrared light that measures oxygen. So normal is 95 to 100. Now one thing about 100 is once it hits 100, we don't know if it's 104 or 105 because that's as high as it goes. So we actually like 95 to 99, but the most it will show on there is 100. One of the neat things is that You see the heart rate right here where I'm circling 72? You want to match that with their pulse rate that you got. Check a manual and then say, oh, I got 70 and this gets 72. That's pretty close. And then you know that that 97 is very accurate. Before you give somebody oxygen, you'll probably want to place a pulse oximeter on their finger and see what their room air without oxygen concentration is, and then what it is when you add oxygen. All these vital signs are going to be reassessed very often. If you have a patient in your care who's what we consider unstable or critical, you're going to reassess vital signs every 5 minutes and document those. Just because you reassessed them and you didn't tell anyone, you want to document. You want to see if there's a trend that they're staying the same, getting better, or getting worse. If they're stable, they have something that's non-life-threatening, back injury or a soft tissue injury or something like that that makes them pretty stable, then you'll want to reassess them every 15 minutes and also document those, again, to see if they're getting better or getting worse. Anytime a situation changes, they go unresponsive, then you're going to repeat your initial assessment, what we call the ABCs. We will cover that in patient assessment, as well as repeat their vital signs. Maybe something changed. If somebody's talking to me and all of a sudden goes unresponsive, first thing I'm going to do is check that pulse and make sure they didn't die on me, rather than taking a blood pressure and taking that time to find out, oops, they're dead. So things to think about. You're going to have a lot of practice with vital signs. I hope you have access to a blood pressure cuff and stethoscope. You can go home and check all of your family's vital signs, including all of these things we talked about: pulse, respiration, skin color, temperature and condition, pupil response, maybe a pulse oximetry, that's kind of cool, and definitely blood.